Let me start by introducing the Evidence for Quality Improvement project. Evidence for Quality Improvement, or E4QI, is a Q Exchange 2019 project that aims to support the QI community to better use evidence in improvement projects. The E4QI project was created to tackle a problem. What was that problem? It was that QI teams do not routinely find and use evidence in QI projects. When we look for it, we get overwhelmed with too much information of various types and quality and struggle to find what we need in a format that we can use. As a result, we repeat mistakes, work less efficiently, make uninformed decisions, and reinvent the wheel. Despite the ups and downs of COVID, we have worked hard to achieve our aim of supporting the QI community to better use evidence in improvement projects. We are now a team of more than 40 QI and library professionals working together to make using evidence for QI part of business as usual. We couldn't do anything we've done without this amazing team of talented people. Working in partnership with library teams, the Academy of Fabulous Staff, and other teams and networks, we have started to increase the use of evidence in quality improvement projects. We've done this in three main ways: empowering and equipping library and knowledge services teams to support the evidence needs of the QI community, creating an appetite in the QI community for using and sharing knowledge, evidence, and best practice. And finally, and just as importantly, if not more important, making connections, building relationships, and creating a community committed to sharing knowledge. We want to break down organisational and disciplinary silos. So what is so special about evidence for quality improvement? Why is it so different to how we use and share knowledge in any other area of the health and social care system? As you will see from this slide, there are some important differences between evidence for quality improvement and for other more traditional forms of knowledge sharing. It also means that QI evidence is much broader and less formal in nature than traditional research publications that are typically the bedrock of evidence in the healthcare sector. Knowledge is no good if we don't use it. So one of the things we've tried to do is to bring some of the best QI resources together on our Evidence for QI Pinterest boards, which you can see here. There are over 800 different resources grouped into boards which anyone, anywhere can access and dip into. Many members of the QI community really love the QI evidence update that my colleague Jess and I from Somerset NHS FT create every month. It's 2 pages, jam-packed full with QI articles, research and reports from the last month. It also includes upcoming events and training. Everything we include is hot off the press and free to access. To conclude, what can you do if you're keen to become more evidence-based in the way that you do improvement projects? Here are a few top tips. Firstly, if you're not already a member, why not join the Q community? It's a network of over 4,000 improvers across the health and social care system. You might also want to check out the Q's special interest groups, or SIGs. These are communities of people who come together around a specific theme, and you don't need to be a Q member to join a SIG. Secondly, why not check out the great content on the Evidence for Quality Improvement Pinterest boards on the link pinterest.co.uk/E4QI. Thirdly, why not save a link on your desktop to the QI monthly evidence updates, and watch out for the next QI evidence update on Twitter or the Academy of Fabulous Staff site. Fourthly, meet your library team. If you work in a QI team, why not invite your library team to QI training and make them feel an extended part of your team? Ask them how they can help you. Fifth, why not request a QI literature search from your library on whatever the project is that you're currently working on? Think how evidence could help you in your work. And finally, share stories of what's worked and what hasn't. We recommend sharing your work on the Academy of Fabulous Stuff as it's free, easy, and anyone can do it. If you want to publish an academic traditional article, then if you are a Q member, then you can publish your article without charge through BMJ Open Quality. Thank you for taking the time out of your day to watch our presentation. If you'd like to join us on the next stage of our journey, please contact me, Andrea Gibbons, at andrea.gibbons@somersetft.nhs.uk. Follow Evidence for QI on Twitter and check out the Pinterest board at pinterest.co.uk/E4QI. Thank you.